Hello, my name is Colin and I'm a student nurse at Drexel University. I'm happy that you're being proactive about your health. By taking a look at your medical records, I can see that your family has a history of cardiovascular disease, and it's to my understanding that you recently had a surgical procedure to have a cardiac stent placed into your coronary artery. And furthermore, I'm aware that you've been prescribed Clopidogrel and have been taking it regularly. I'm glad that you inquired about pharmacogenetic testing for the CYP2C19 enzyme, because that's one of the topics I like to review in my consultations. And if it were found that you've had any abnormalities or missing the enzyme, it may have a lasting implication on your health. Because of your small African American and Chinese background, I have to mention that you do have a tiny bit of a higher risk for having an enzymatic abnormality. So again, I'm glad to see that you are taking an active role in this process. As you may or may not know, the CYP2C19 enzyme is a type of cytochrome P450, a liver enzyme that metabolizes clopidogrel into its active component. If you have a deficiency in this enzyme, or if you take a CYP2C19 inhibitor, it will lead to decreased levels of active clopidogrel, which may lead to an increased risk for platelet aggregation in the blood, forming a blood clot. Ultimately, this will put you at a higher risk for a number of complications, including a myocardial infarction or a heart attack. That being said, pharmacogenetic testing can easily detect such enzymatic deficiencies. If that were to be the case, there are medications that you can take to offset this enzymatic imbalance. While getting tested is important, it's also just as important to discuss with your provider about any other medications that you're currently taking. Some medications can actually inhibit the CYP2C19 enzyme, and so we want to know what you're taking to prevent this from happening. Beyond the pharmacogenetic testing and eliminating any medication interferences, I want to see you exercising moderately, keeping a low sodium diet, and refraining from smoking. The goal here is to keep your heart healthy and to decrease your risk for heart disease and further complications. Should you have any further questions, you can always feel free to reach out and I'd be happy to be of assistance.